Calcium channel blockers are recommended first-line treatment option in black patients. They may also be useful in hypertensive patients with diabetes or stable ischemic heart disease. High doses of short-acting calcium channel blockers should be avoided because of increased risk of MI due to excessive vasodilation and marked reflex cardiac stimulation. अब क्लासेस की बात करते हैं. तो हमारे पास DBD क्लासेस होती हैं, डाइफेनाइल अल्काइलामाइंस, डाइहाइड्रोपाइरिडीन्स एज आई टोल्ड यू बिफोर. अच्छा, उसके अलावा बेंजोथाइजिपीन में डिल्टायाज़म याद करें, और डाइफेनाइल अल्काइल अमाइंस DPAA. ठीक है, इसमें आपने वेरापेमिल याद रखनी है बस. It is the only member of this class that is available in US. Verapamil has significant effects on both heart and vascular smooth muscle cells. It is also used to treat angina and supraventricular tachycardia, and it is also used to prevent migraine and cluster headaches. अच्छा, वेरापेमिल आपने माइग्रेन में देना है, ये तो आपको पता होगा. अच्छा, देन वी हैव डिल्टायाज़म जो कि बेंजोथाइजिपीन है. It's the only member of this class which is currently approved in US. Okay. Like verapamil, diltiazem affects both cardiac and vascular smooth muscle cells. It has a less pronounced negative inotropic effect on the heart compared to that of verapamil. It has a favorable side effect profile. Avazes are dihydropyridines, which includes nifedipine, which is a prototype, amlodipine, felodipine, isradipine, nicardipine, and nizoldipine. These agents differ in pharmacokinetics, approved uses, and drug interactions. All dihydropyridines have a much greater affinity for vascular calcium channels than for calcium channels in the heart. They are particularly beneficial in treating hypertension. Dihydropyridines have advantage in that they show little interaction with other CVD drugs such as digoxin or warfarin. ये बहुत important है, which are often used concomitantly with calcium channel blockers. डायलेशन ऑफ करोनरी ब्लड वेसल्स हुई तो उसमें आपने सबसे ज़्यादा अच्छा एक्शन जो है ना नाइफेडिपीन का है. अच्छा, एवी कंडक्शन हुई तो वेरापेमिल, फ्रीक्वेंसी ऑफ एडवर्स इफेक्ट्स हुए तो नाइफेडिपीन मोस्टली. अच्छा, एक्शंस आ जाते हैं हमारे पास कैल्शियम चैनल ब्लॉकर्स के. इंट्रासेलुलर कैल्शियम कॉन्संट्रेशन प्लेज एन इंपॉर्टेंट रोल इन मेंटेनिंग टोन ऑफ द स्मूथ मसल एंड द कंट्रैक्शन ऑफ द मायोकार्डियम. Calcium channel antagonists will block the inward movement of calcium by binding to L-type calcium channels in the heart and smooth muscles of the coronary and peripheral arteriolar vasculature. This causes vascular smooth muscles to relax, dilating many arterioles. Calcium channel blockers do not dilate veins. Therapeutic uses in the management of hypertension. Calcium channel blockers may be used as initial therapy or as an add-on therapy. They are useful in treatment of hypertensive patients who also have asthma, diabetes, or peripheral vascular disease. Because unlike beta blockers, they do not have the potential to adversely affect these conditions. All of the calcium channel blockers are useful in treatment of angina. In addition, diltiazem and verapamil are used in the treatment of atrial fibrillation. Pharmacokinetics of calcium channel blockers. They have short half-lives, 3 to 8 hours following an oral dose. Sustained release preparations are available and permit oral once daily dosing. Amlodipine has a very long half-life and does not require sustained release formulation. Adverse effects आ जाते हैं. Vertigo, यानी headache, hypertension, peripheral edema, dizziness and flushing. Adverse effects, first degree AV blockade and constipation. First degree AV blockade भी आ जाता है, ये जो है ना verapamil की वजह से होते हैं. Verapamil जो होते हैं and diltiazem, they should be avoided in patients with heart failure or AV blockade due to their negative inotropic effect, जो कि verapamil में ज़्यादा होता है. Force of cardiac muscle contraction and durametropic, which is velocity of contraction effects. Dizziness, headache, feeling of fatigue caused by decreasing BP, and they're more frequent with dihydropyridines. Peripheral edema is another commonly reported side effect of this class. Nifedipine and other dihydropyridines will cause gingival hyperplasia. Okay, I did not know that. Alpha adrenergic receptor blocking agents is a trazosine, doxazosine, and tamsulosin. Alpha adrenergic receptor used in treatment of hypertension, including trazosine, doxazosine, trazosine. They will produce a competitive blockade of alpha adrenergic receptors. They decrease the peripheral vascular resistance, ठीक है, mainly smooth muscles की contraction से. Lower the arterial blood pressure by causing relaxation of both arterial and venous smooth muscles. They cause only minimal change in cardiac output, renal blood flow, glomerular filtration rate. Therefore, long-term tachycardia does not occur, but salt inverted retention does occur. Reflex tachycardia and postural hypertension often occur at the onset of treatment with dose increases. When dose increases requiring slow titration of the drug and divided doses due to weaker outcome data and their side effect profile, alpha blockers are no longer recommended as an initial treatment for hypertension, but they may be used for refractory cases. The alpha-1 blockers with greater selectivity for the prostate in treatment of VPH or tamsulosin. Alpha or beta adrenergic receptor blocking disease. इसमें हमारे पास आ जाता है हमारे पास मतलब beta-lol and carvedilol. They will block alpha-1, beta-1, beta-2 receptors. Carvedilol is indicated in patient of heart failure and hypertension. It has been shown to reduce morbidity and mortality. associated with heart failure. Labetalol is used in management of gestational hypertension and hypertensive emergencies. उसके बाद हमारे पास आता है सेंट्रली एक्टिंग एड्रेनर्जिक ड्रग्स. ये कैसे बहुत ज़्यादा अच्छा लिखा हुआ है. यहाँ पे क्लोनिडीन याद रखें, मिथाइल डोपा याद रखें. क्लोनिडीन जो होता है सेंट्रली एक्ट करता है एज अल्फा to agonist to produce inhibition of the sympathetic vasomotor centers, decreasing the sympathetic output flow to the periphery. This leads to decrease in the total peripheral resistance and increased VP. Clonidine is used primarily for treatment of hypertension that has not responded adequately to treatment with 2 or more drugs. Clonidine does not decrease renal blood flow or glomerular filtration. Therefore, it is used in treatment of hypertension complicated by renal disease. It is well absorbed after oral administration. It is excreted by the kidney. It is also available in transdermal patch. Adverse effects include dry mouth, constipation, and sedation. Rebound hypertension also occurs after following withdrawal of clonidine. This drug should therefore be withdrawn slowly if discontinuation is required. Methyl dopa. It is an alpha 2 agonist that is converted into methyl norepinephrine, centrally to diminish the adrenergic outflow from the CNS. The most common side effect of methyl dopa is sedation and drowsiness. Its use is limited due to adverse effects and the need for multiple daily doses. It is mainly used for management of hypertension in pregnancy, where it has a record of safety. Side effects of clonidine: confusion, hypertension, drowsiness, dry mouth, and constipation. Vasodilators की बात करते हैं, ये बहुत लंबा है. Direct acting smooth muscle relaxants such as hydralazine and minoxidil. They are not used as primary drugs to treat hypertension. They can act by producing relaxation of vascular smooth muscles primarily in arteries and arterioles. This results in decreased peripheral vascular resistance and therefore BP. Both of the agents will produce reflex stimulation of the heart, resulting in competing reflexes of increased myocardial contractility, heart rate, and oxygen consumption. These actions may prompt angina pectoris, MI, or cardiac failure in predisposed individuals. Vasodilation also increases the plasma concentration, resulting in sodium and water retention. These undesirable side effects can be blocked by concomitant use of diuretic to decrease the sodium retention and beta blocker to balance the reflex tachycardia. Together, the 3 drugs will decrease cardiac output, plasma volume, peripheral vascular resistance. Hydralazine is an accepted medication for controlling BP in pregnancy. Induced hypertension. Adverse effects of hydralazine include tachycardia, nausea, sweating, arrhythmia, headache, respiration of angina. Lupus-like syndrome can occur with high dosages of vasodilators like hydralazine, but it is reversible upon discontinuation of the drug. Minoxidil treatment causes hypertrichosis, यानी कि ears के growth of body hair. Drug is used topically to treat male pattern baldness. अच्छा, उसके बाद हमारे पास हाइड्रालाजीन के एडवर्स इफेक्ट्स देख लेते हैं. नोजिया, एंजाइना, palpitations, tachycardia, headache. Hypertensive emergency is a rare but life-threatening situation characterized by severe elevation in BP, systolic greater than 180 or diastolic greater than 120, with evidence of impending or progressive target organ damage, for example, stroke, MI. Severe elevation of BP without evidence of target organ damage is considered a hypertensive emergency. Hypertensive emergencies require timely BP reduction with treatment administered through IV to prevent or limit target organ damage. Variety of medications are used, including calcium channel blockers like nicardipine and clebidipine, nitric oxide vasodilators, nitroprusside and nitroglycerin, and adrenergic receptor blockers like phentolamine, esmolol, and labetalol, vasodilator hydralazine, and dopamine agonist phenolopam. Treatment is directed by a type of target organ damage and comorbidities that are present. Resistant hypertension is defined as blood pressure that remains elevated despite the administration of an optimal 3-drug regimen that includes a diuretic. Most common cause of resistant hypertension are poor compliance, excessive ethanol intake, concomitant conditions, diabetes, obesity, sleep apnea, hyperaldosteronism, high salt intake, or metabolic syndrome. Concomitant medications like sympathomimetics, NSAIDs, or corticosteroids in sufficient dose or drugs and use of drugs with similar mechanism of action. Okay, so phenolopam is selective alpha-1 dopamine agonist. IV is its route and its half-life is 5 to 10 minutes, and it is mostly important in renal impaired patients and hypertensive emergencies. It increases the natriuresis and diuresis, and unlike dopamine, there is no tachycardia from beta stimulation or no vasoconstriction from alpha stimulation. Contraindication is glaucoma. Adverse effect is hypokalemia.